All right, a 26-year-old presented with a 7-week lateral neck swelling? Let's take her history. First, biodata. We use the mnemonic NASA Moretti name. Age, sex? Well, we already know. Female. Address. Marital status? Single? Married? Or it's complicated? I don't know how you are going to include a complicated marital status in your history, so please don't ask me that one. Occupation? She's a postgraduate student. Religion? Education? The patient has a tertiary level of education. Tribe or ethnicity? Informant? Luckily, it's our patient herself. There are occasions where the patient is not conscious, or it's a child, the informant might not be the patient. It's also important at this point to state if the information gotten is reliable. There can be lots of reasons why the information is not reliable. Maybe they are intoxicated, confused, or it's coming from someone who doesn't live with the patient. There are other situations like memory issues, third parties or eyewitnesses' history, even psychiatric disorders. And if you happen to encounter any of these peculiarities, you must state it immediately. Because our patient is female, we want to know her LMP. Now let's go to the presenting complaint left lateral neck swelling of 7 weeks. Then ask for any other complaints. We will be using the 5 C's approach. Complaints, analyze the presenting complaint or complaints. Course, we dig into the life journey of the symptoms as well as every other symptom associated to the condition by pathophysiology. We unravel every single twist and turn as much as we can. Cause, this is where we whip out our giant list of suspects and start crossing names off. Complications. Analyze other problems complicating the presenting complaint. Care so far, we analyze interventions, the treatment and investigation the patient has done pertaining to the disease. Complaint. Neck swelling. Got it. Next, we go to the course. Ask questions about this patient's PC analysis of everything we can get on the complaint. We can start with timeline or onset. When exactly did the swelling start? Sudden, gradual, or insidious? Insidious onset swelling means that the swelling started very slowly and gradually. It didn't appear suddenly instead. It developed little by little over time, and the person might not have noticed it at first, especially if they say they didn't know when it started. They just stumbled on it when they were doing blah, blah, blah. Progression. The estimate of the size when it was first noticed. Has the swelling grown larger, fluctuated in size, or stayed the same? Any changes with movement, swallowing, or eating? Does it vary with time of the day or activity? If yes, when is it worse or better? Any previous episode of body swelling in the past? Tenderness. Is it painful or painless? Consistency. Is it more like a marshmallow or a rock? Soft, firm, hard, cystic, or fluctuant? Mobility. Is this swelling mobile or glued in place? Fixed lumps are suspicious. Associated symptoms. Fever, weight loss, night sweats suggest TB or lymphoma. Recent sore throat, upper respiratory symptoms, or dental infection, reactive lymphadenopathy. Skin changes or discharge over the swelling, abscess or infection. Inquire about swelling or swellings in other parts of the body. The cause. To explore potential causes and rule out or rule in differentials, questions in this case includes: I posted a reel where I listed up to 20 differentials, but we will rule out about 5 or 6. Already the data you collect based on the analysis of complaint will rule in or rule out some differentials. For example, if the swelling was sudden, it wasn't there. A day before then, she woke up 6 weeks ago and it was there. With such sudden onset, you won't be thinking neoplasm. You won't consider congenital lesions like branchial cleft cysts and thyroglossal duct cysts. You won't also be thinking chronic infections such as tuberculosis or fungal infections or even autoimmune conditions like sarcoidosis, lupus, or Kikuchi disease, which usually cause swelling over time. Instead, we could be dealing with more acute causes like infections, acute lymphadenitis or abscess formation, trauma, hematoma from an injury, allergic reactions, angioedema, or an inflammatory response. If the swelling was painful, there are some things you won't consider. You'll rather think of acute infections, trauma, abscess, or inflammatory conditions. If the swelling is soft, some things come to mind like lipoma, abscess, lymphadenitis. And it might even suggest cystic lesions like branchial cleft cyst, dermoid cyst, lymphangioma, or salivary gland disorders. Another thing to consider is the subjective nature of history. This is what the patient thinks. Several times patient has noted something as painful, swollen, lumpy, or hard, and when we examine, there was no pain, no swelling. So that's why examination is also there, even investigation. None is to stand alone because you are human. Even during examination, you can miss a thing or two. So you are to do a good history and examination and request relevant investigation. Let's continue. So, because in this case, patient had a progressive 7-week painless firm, left lateral swelling with fever. We considered tuberculous lymphadenitis and asked for chronic cough, drenching night sweat, weight loss, consumption of unpasteurized milk, exposure to persons with chronic cough, or someone with TB, previous TB infection, and overcrowding. Then lymphoma, because these are basically cousins of TB, but with more drama. We're asking the same questions, like fever, weight loss, night sweats, difficulty breathing, other swollen lymph node, anorexia, family history. Of course, you don't need to repeatedly ask the patient the questions you have asked before, just the additional questions. Next, we considered metastatic lymphadenopathy. This could come from salivary gland tumors, numbness or weakness in the face, like difficulty moving the mouth or closing the eye, lumps near jawline or underchin. For nasopharyngeal carcinoma, epistasis, nasal fullness. Also rule out leukemia, weakness, fatigue, easy bruising. And for the ladies, we got to ask about breast lumps and gynecological malignancies, previous cancer or exposure to radiation, family history of malignancy, HIV and other immunocompromised state, because yes, HIV can cause generalized lymphadenopathy and swollen cervical lymph nodes. Ask of persistent diarrhea fever, oral thrush, sharing of sharps, multiple intimate partners. Rarely sarcoidosis, persistent dry cough, shortness of breath, eye skin symptoms, and other constitutional symptoms we have asked about. Rule out fungal infections, trauma, and cat scratch disease for completeness. Complications. Is this lump causing breathing problems, swallowing issues, or voice changes, or just being a nuisance in selfies? This will affect your line of management. Inquire about changes in overlying or surrounding skin emotional stress and overall well-being. Let's move to care so far. What has she tried? Home remedies? That one aunt's herbal tea? Or did she just hope the lump would get bored and leave? Previous treatments? Referrals? What has been done since she arrived at the hospital? Is this her first visit here? You want to know why the patient waited for 7 weeks and why she finally decided to come? Medical and surgical history. History of admission. How long, and for what? Look for chronic conditions. Use the shaped mnemonic: sickle cell disease, hypertension, asthma, peptic ulcer, epilepsy, and diabetes. Ask for previous surgeries, previous blood transfusions. Inquire about medications, previous and present, anyone she is on. A little bit on menstrual history. I know this isn't an OB/GYN case, but just for completeness. History of allergies and medications she reacts to, if any. Social history: does she smoke? Calculate pack years if she does. Does she drink? Calculate the unit if she does. Family history: marriage, parent. History of chronic illness. Finally, we quickly run through the review of systems. Just few questions from systems you didn't touch in history. We ask about nervous system, endocrine, gastrointestinal, cardiovascular, genitourinary, and musculoskeletal. In the next video, we will post the history we got for this case, the findings on investigation, and how we manage the case. And also, you won't want to miss the burning questions that came up during this dramatic case presentation, so make sure you subscribe and turn on notifications. Don't forget to give us a thumbs up, and any suggestion you have will be greatly appreciated in the comments section. We will see you in the next video.